As the United States struggles to contain the spread of the Omicron variant of COVID-19, reports indicate that the Centers for Disease Control and Prevention, CDC, may consider recommending that those who can wear a mask do so in public places, specifically the KN95 and N95 masks that have been in high demand. It has increased significantly over the last 2 years. The CDC is actively reviewing its recommendations for KN95 and N95 in light of Omicron, an unnamed official stated. We know these masks provide superior filtration. The news comes as the CDC and Biden face increasing pressure to modify their COVID-19 strategy on a variety of fronts, from home testing to isolation requirements to vaccine mandates. However, the policy of masking is still very much alive, and the debate over which masks provide the best protection has been a point of contention since the pandemic began in earnest. The KN95 and N95 masks. Why is the CDC being pressed to recommend these particular masks? Why are they superior to the cloth masks worn by the vast majority of people, and how, given their relative cost and sometimes difficulty in obtaining in the United States, can they be reused? How are they superior? The N95 and KN95 masks work by tightly fitting to the face and filtering the air with multiple layers of materials designed to trap extremely small particles, something that ordinary clothing and disposable masks are incapable of doing. N95 respirator masks are the recommended high-level face coverings for healthcare workers in the United States. According to the CDC, regulator-approved N95s filter up to 95% of airborne particles when fitted properly to form an airtight seal around the face. It may feel more difficult to breathe than a standard mask, and it is more expensive. Meanwhile, KN95s are more affordable and widely available. It was not approved for medical use in the United States prior to the pandemic, but it was licensed as a stand-in for N95s when necessary. They are, however, approved by a variety of international standards, though the CDC cautions that many of these standards lack specific quality requirements. Most notably, up to 60% of those available in the United States are counterfeit. How are you going to repurpose it? N95 masks should not be reused under normal circumstances, as directed by the Centers for Disease Control, CDC. However, due to supply issues with masks and other personal protective equipment during the pandemic's first year, the agency issued guidelines for their reuse, as healthcare workers cannot rely on a constant supply of new, high-quality disposable masks. According to 2020 research, the most effective methods for reusing N95s included rotating them several times over several days, heating them to 70 degrees Fahrenheit for an hour, and even steam cleaning or boiling them. However, washing it with soapy water or alcohol is not recommended. This, however, refers to the masks worn by healthcare workers in high-risk environments. For those who use masks on a daily basis and are able to follow other precautions, experts have suggested a simpler method that works for both N95s and KN95s. Place the used mask in a dry brown paper bag for a day or two, effectively drying the mask while preventing any virus remaining on it from infecting anyone nearby. Thanks for watching. If you enjoy our content, please like, share, and subscribe.